Hello and welcome to the 13A detailed mock feedback. If you are not in 13A and you're actually in 13C, then you're looking for the other video that was the previous video that's been uploaded. So for those of you in 13A, this is the mock feedback that I'm giving you based on your mock that you took on 20th of November, which involved the health content. Now, the idea of this is you'll be assigned a purple pen task for homework, which enables you to go through your mock and add in detail what needs to be done. I think it's important that we go over some stuff in lesson, but what is important is that you have the chance to look in a detailed way at the mark scheme and listen to what you could have included and read what you could have included in your essay. And this enables you to do this in your own time. And as you know, we've got a lot of content to get through for the A level. So this allows you as a homework task to access the information, and it also can be a useful revision tool to make sure that you're using mark schemes to help prepare for the exam. Now, the first stage of this, you'll see on your mock feedback sheet, I have provided you with a list of numbers and codes based on your what went well and EBIs per question. So you might have done something good in question 1, but you haven't done that so well in question 3. So what I want you to do is pause the video at this point and note down what your what went wells were for each question and what your EBIs were, and you might begin to see a pattern and you know that that's the area that you need to work on. So just pause the video at this point to note down where you are. Okay. Now, the first question that you had to answer was to outline and explain 2 differences between the social and biomedical models of health in their understanding of mental illness. Now, there's lots and lots that you could talk about here. Luckily, we'd done a essay on the biomedical model of health recently, which enabled you to have a bit more knowledge of the topic. But the mark scheme always gives a section of indicative content, so things that they expect students to mention based on what they know is on the specification, they know is in the textbooks, they know sociology teachers are teaching. Now, this isn't to say that you are limited to what they've listed here, but on the whole, the points that are covered in the mark scheme will include what you've written. Now, this question was answered okay. It was answered pretty well, and lots of you drew on the ideas that, the social model deals with treating the causes and dealing with the causes to prevent ill health from happening, whereas the biomedical model is more about treating symptoms, which means that the illness is likely to return again. I think the trap that we often fell into, we were talking about illness in general, not specifically linking it to mental illness, and an easy way to do that is by providing examples. So you can say that, but provide specific examples in linking it to something like depression or anxiety or schizophrenia or bipolar, making sure that you're linking it to that, and then it's obvious that you're talking about mental illness and not just illness in general. Now, the points here are there's 8-9 points that you could have included, and the areas that we focused on as a class really were this idea about prevention versus cure, the idea that there are some community-based treatments in the social model versus kind of clinical medical treatments in the biomedical model. Some of you also touched on the idea that one of the perspectives focuses on looking at the individual and how the individual, based on their class, ethnicity, gender and age, might need a different kind of treatment or have a different understanding. Some of you focused on the idea that the biomedical model looks into, it's got some aspects of power involved in it and labelling. So looking at certain sociologists there that could talk about labelling. But if you pause the video at this point, you can note down some of these areas that are to do with mental illness. Cultural explanations to do with, perhaps there are reasons in certain maybe ethnic groups that cause higher levels of mental illness. When it talks about holism, that can also be drawing on this idea of the complementary model and the increase in alternative medicines, which has come out of trying to find a solution between the biomedical and the social model. But if you pause at this point, you can add some notes to what you could have included in your purple pen here. Now, looking at the mark scheme, in order to get into this top band, you need to evidently show very good knowledge and understanding of these 2 topics. That means including sociologists, that means including key terms, and not just throwing in a key term, using it correctly so the examiner knows that you know what it means. There's no point chucking in iatrogenesis but you don't explain what it means, or you don't demonstrate how it links to the question. Because well done for learning how to spell it, but other than that, it's not going to be of any value unless you link it to the question. Now, the two applications that need to be relevant here are focusing on the idea that mental illness maybe is caused by something that's environmental, whereas a lot of the biomedical view of mental illness is more to do with a biological internal process, which tends to mean that we tend to place blame on the individual in the biomedical model, or say it's bad luck, random attack of disease, whereas in the social model we tend to see this understanding that society perhaps create mental illness, and there's less blame put on the individual and more blame put on society and structures in society as a whole. And then dealing with this argument between community-based therapies. We've looked at examples of the use of music therapy. We've also, if you've had a chance to watch the Care Home for 4-year-olds on Channel 4, that's a community-based therapy, which definitely showed some evidence to suggest that is improving, and that's a good application, a good contemporary example that you can use there. And this is in comparison to things like antidepressant drugs, which, whilst do deal with the symptoms, they don't necessarily deal with the cause and don't guarantee that the feelings of depression or anxiety would return. We need to then, unpick that, and you can either evaluate, but you could also provide some in-depth analysis using phrases like this shows that, this means that, this demonstrates that, the impact this has on society is. Those phrases demonstrate to the examiner, scream to the examiner, look, I'm analysing this for you. I'm picking this apart. I'm not assuming that you know what I mean. And that's a pattern that a lot of us are falling into. You assume the examiner knows what they're talking about. Now, I know what you're talking about because I've taught you, but the examiner hasn't taught you. And so you need to make it crystal clear using those sentence starters that I've gone on and on and on about to demonstrate that you know what you're talking about. Here is a brilliant paragraph which is talking about one of the differences. It's focusing on the treatment, so that's part of the mark scheme, so brilliant, easy connection there. They provided some examples here of how antidepressants are used for things like OCD, anxiety and depression. Now this student also does psychology, so has included some of her knowledge from that. Now this also looks at how the social model can focus, it's given another example, music therapy, and we've discussed that in lesson. Includes this idea of medicalisation, showing excellent AO1 understanding, but then also goes on to include some sociologists here. So it's looked at Zaz and how this view that psychiatry is fraudulent because we never can understand what's going on in someone's mind, which provides some analysis and evaluation of this concept and the idea that treatments are different. And then even brings in the complementary model. So this shows a wealth of understanding of the topic, which is really impressive. Have a go at pausing that to maybe read through and see how you could make your paragraphs more like this paragraph. This is a brilliant point that's been made here. Okay, the next question is one of those difficult 10-mark questions where you have to apply the item. So it doesn't say you use your own knowledge, you have to find those 2 points from the item. It was quite an accessible question looking at how social class differences in the use of healthcare provision play out. Now, some people fell into the trap of talking about, is this talking about social class differences in healthcare inequalities? And it's not to do with that. It's specifically about how do social classes access healthcare. So in the item, it gives you the idea that middle-class patients have longer consultations with their GP, and that draws on the research by Dixon that we looked at extensively in lesson. And they also look at the idea that there are class differences in the use of preventative care, like vaccinations and dental checkups, and that can draw on research that's been carried out by various sociologists that draws on the fact that perhaps lower class groups tend to have less educational qualifications. If they've not participated as much in school as middle class patients, they might have less understanding of why a vaccination or why a dental checkup might be good, or there are those barriers such as being in a job that's paid hourly and therefore they can't get time off work because that would mean that they couldn't have income for the family. And that's all linking into the ideas that we see from Tudor Hart and the inverse care law, where care is given in inverse proportion to need. So you could include his ideas. And some of you even attempted to talk about the idea that in that's introduced by Hart and the swimming pool analogy about when you've got doctors. There are lots and lots of doctors in the middle class wealthy areas who have got enough patients and they're quite happy, and then in the other parts of the country, more associated with the north of England, we see not many doctors and lots of patients. And this is, you know, talking about the north-south divide and how healthcare is definitely not dealt with in equality based between these two areas of the country. So you can draw on those ideas and, you know, go back to your lesson notes and go back to the PowerPoints that are on Edmodo to understand how that all links in. So here, the things that it wants you to talk about and it wants you to take from the item are the idea that you're getting middle class patients with longer consultations, and of course the idea that middle class patients tend to have a better knowledge of preventative care. And here we draw, exactly as I've said before, you're looking at cultural factors, that's perhaps an educational factor, and economic factors like we've spoken about, employment rates that are having an effect on this change. Again, including sociologists is brilliant, including contemporary examples is brilliant, and here is a paragraph which demonstrates this very well. So it starts off, it really unpicks the analysis in this paragraph. I wouldn't say that it overdoes it, but it's crystal clear why it is that the middle classes are getting better and longer treatments. And they've even included this idea that we've looked at before, escaped medicine, where they're looking up their symptoms online, and because they've got the money to have access to the internet, that's another thing that's, you know, perhaps allowing them to have a better level of care, a better access to care. They've mentioned that there's therefore a divide in healthcare. It's drawing on these ideas that we've spoken about throughout the course. And then gone on to provide some evaluation using a theoretical perspective, and you know, saying that actually the internet is now quite wide, and this student's actually dealt with something from the media content, so bringing in those synoptic links from the media content that can actually link it to health, which is very clever, shows great knowledge and understanding and great ability to apply sociological concepts across the board. This question I thought was going to go well, and for some of you it did. We need to get into the habit of using the item in the 20-mark question. What happens is you read the question and you're like, I could talk about this because I know what the feminists say, and I know what the functionalists say, and I know what the Marxists say, and I know what the postmodernists say, without dealing with the question and the item, okay? So you need to be using those sentences of serves the interests of powerful groups in every single paragraph. Some of you are brilliant at this, some of you are not so brilliant at this. Now, there are various sociologists that you can use to talk about this, and sociological perspectives are born to be in this kind of question. However, these are the key terms that could be used here. So we're looking at big pharma and the health industry. So that's more on the Marxist side of the argument, bringing in the ideas of Goldacre and Law, who are talking about the exploitation and the emphasis on making money and profit that we see. You could also talk about how the sick role is a way to control people, but you can also include the ideas of the functionalists that actually doctors are altruistic. Lots of you brought in the idea that, you know, of Dr. Shipman and how that critiques those ideas. Things like the male gaze and patriarchy and how that is therefore, you know, a powerful group in society. But then you can also go on to use some other examples that maybe suggest that it's not about that, and actually healthcare is becoming more individualized, and we now have the power. It's not about the powerful groups, but now, you know, with the internet technology that we have now have the power to deal with this. Now, the question, again, as always with the 20-mark question, because there's so much that you can include in these answers, it's not very specific as to what it really, really wants in the top answer, but this is where you have to show your evaluation. The question at the end of the day, as you can see if we flick back here, asks you for evaluation. If you don't provide any evaluation, you cannot get into those top bands. So we need to be seeing here that it's developing examples and debate through different perspectives. What does one leave out? What does one include? What does one explain? What does one not explain? Which of those are out of date? Which of those have got contemporary examples and evidence to support them? And you need to bring that in to be able to get into the top mark, and the top mark band. What's really, really crucial as well is that you're not just necessarily providing evaluation in those however statements at the end, but you're maybe bringing in, as we've looked at a screencast from Park Sociology, they speak about this idea of having a mini paragraph that provides some evaluation statements, or their idea of the smart art paragraph where you, right at the end of the essay, challenge everything that the question asks you to do. Okay, the thing that is important is that evaluation has to come at the forefront in these questions, because that is the command word in the question. It's less important in the other 2 10 markers, but this is where you show your knowledge and your ability to be analytical and be evaluative. And here's just a paragraph that you can pause and have a look at that deals with this very well. So it's got the contemporary example of Dr. Shipman. It deals with functionalism and includes some key terms to show that there's some knowledge. It deals with sociologists to show that there's some knowledge, and uses this contemporary example to critique, and quotes the item as well, which is brilliant.